What if one routine test meant to protect your health was actually pushing you closer to surgery, stroke, or even cancer? What if nearly every senior over 70 was unknowingly agreeing to it, thinking it's just another normal part of aging? And what if I told you that one of these tests causes just as many cancers as drinking alcohol every single day? I'm Dr. Nana, and today, we're diving into the 5 most dangerous checkups seniors over 70 should avoid and why skipping them might actually protect your life. Main content begins every year. Millions of seniors show up faithfully for health screenings, believing they're making the right move. But behind the reassuring smile of your clinic, behind the clipboard and routine checkmark, lies a different reality, one your doctor probably never talks about. According to recent studies, up to 37% of medical tests performed on seniors lead to unnecessary treatments, risky complications, or even permanent side effects. And shockingly, 99% of adults over 70 have no idea they're being overtested. Let's talk about the most alarming example. One checkup ranked number 1 on our list actually causes 5% of all cancer cases in the US. That's on par with the cancer risk from daily alcohol consumption. Yet you'll never see a warning on a billboard or hear it in a waiting room. The truth isn't hidden by accident, it's buried in the fine print of medical journals. But not anymore. Today, we're unearthing that truth, test by test. In this video, I'll walk you through the 5 health checkups that seniors over 70 should avoid and the science that explains why they may do more harm than good. Stick with me until the end, because what's sitting at number 2 might be the most shocking of all. But before we dive in, I want to hear from you. Drop a comment below and tell me, where are you watching from? How old are you? And have you ever had a test or procedure you later regretted? Do you think seniors are tested too much? We're reading every single comment and I'll be personally replying with helpful advice. And don't forget to like this video and subscribe to Senior Health Boost so you never miss science-backed, life-saving tips like this one. Checkup number 5. Bone density scan. Let's start with the test that seems totally harmless but could quietly wreck your quality of life. Number 5. The bone density scan. You've probably heard of it. It's quick, painless, no needles, and you walk away with a simple result. Are your bones strong, or are you at risk for a fracture? But here's the part no one talks about. After the age of 70, bone density scans, officially called DEXA scans, often cause more fear than benefit. They're meant to check for osteoporosis, but by this stage of life, almost every result shows some degree of bone loss, even if you're perfectly healthy. That's because bone thinning is a natural part of aging, just like gray hair or wrinkles. But instead of reassurance, many seniors are pushed toward powerful medications like bisphosphonates. These drugs are supposed to strengthen bones, but they come with some seriously frightening side effects: jaw necrosis, where the jawbone starts dying, esophageal inflammation, severe digestive distress, and even fractures in unusual places. Now, here's what the science says. A major study from the Journal of the American Geriatric Society tracked over 1,200 women above 70. After 5 years on bisphosphonates, their risk of fracture dropped by just 0.3%. That's barely a change and certainly not worth the price many women paid. In fact, most were more likely to suffer from the side effects of the drugs than to avoid fractures. Let me share the story of Rose. She's a 76-year-old retired piano teacher who had never fallen, had no pain, and walked daily. But after a routine checkup, her doctor sent her for a bone scan. The result? Osteopenia, mild bone loss that doesn't qualify as osteoporosis. Her doctor put her on alendronate, a bisphosphonate. Within 3 months, Rose developed intense acid reflux and painful jaw aches. When she came to see us, she hadn't touched the piano in weeks. We immediately took her off the medication and started a natural approach: vitamin D, resistance exercises using bands, and a calcium-rich diet with foods like sardines and dark leafy greens. 1 year later, she was back on stage, performing confidently with stronger legs, better balance, and most importantly, no fractures. So while a DEXA scan might sound smart, for many seniors over 70, especially those who haven't fallen or shown signs of bone problems, the smarter choice is lifestyle first, drugs second. Up next, we'll explore the test that's recommended at nearly every annual checkup but may quietly increase your stroke risk without a single warning. In the last section, we uncovered how a seemingly harmless bone density scan could lead to unnecessary medication, frightening side effects, and even rob someone of their independence and joy, and lifestyle changes would have worked better. But what if I told you the next test on the list isn't just unnecessary, it might actually push you into brain surgery? Let's talk about that. 4 brain MRI for memory loss. Memory slips are scary. Misplacing your keys, forgetting a name, walking into a room and forgetting why, it can all feel like the beginning of something worse. For most seniors, that fear quickly spirals into one haunting thought. Is this the start of dementia? And once that thought creeps in, the pressure to get answers fast becomes overwhelming. So what do many doctors do? They order a brain MRI. Now, MRIs are powerful machines. They create detailed images of the brain and are often praised as one of the greatest medical tools of our time. But here's the uncomfortable truth. In people over 70, MRIs rarely deliver the answers you hope for and often create more harm than good. Why? Because the brain naturally changes with age. Shrinkage, white matter, spots, and minor irregularities. They're completely normal for someone in their 70s or 82nds. But to someone already anxious, seeing those changes on a scan can be terrifying. And the consequences of that fear, they can cascade. Suddenly, you're being told to get more tests, maybe even a spinal tap, a biopsy, or in worse cases, even surgery. All based on findings that may never have caused a single problem in your life. Let me break this down with real data. In 2021, Neurology Today published a study of over 3,000 patients between the ages of 70 and 85 who reported mild cognitive complaints, things like occasional forgetfulness or feeling mentally slower than usual. Here's what they found. 86 of those MRIs showed some form of brain abnormality, but only 3% were tied to an actual treatable condition. That means 97% of patients were essentially told, something looks wrong, when in fact, nothing truly was. And here's the worst part. Nearly 12% of those people were referred for invasive procedures like lumbar puncture, spinal taps, or exploratory brain biopsies, all because of a scan result that didn't mean much. These are real people facing real emotional tolls. Let me introduce you to George, a 74-year-old retired engineer. A sharp guy, full of stories and wit. But like many seniors, George started to feel a little forgetful. He lost track of names, sometimes walked into a room without remembering why. His mind immediately jumped to Alzheimer's. His doctor, hoping to ease his worry, ordered a brain MRI. The result? White matter changes, totally normal for his age. But George didn't hear normal. He heard abnormal. He panicked. He stopped driving, stopped going to church, started withdrawing from life. Over time, his anxiety made everything worse. He became more forgetful, more fearful. But when he finally came to us, Dr. Nana ran a standard cognitive screening test, a paper-based tool designed to evaluate memory, focus, and reasoning. George's score? Completely within the normal range. We explained to him carefully and compassionately that those changes on his MRI were typical for someone his age. Then we gave him tools to take back control, better sleep hygiene, hydration, mindfulness techniques, and even brain training games. And in just 3 months, George bounced back. His memory felt sharper, his mood lifted, and most importantly, he got his life back. The takeaway? Unless you're experiencing severe neurological symptoms like seizures, sudden changes in personality, or rapid physical decline, an MRI is not the right first step for mild memory loss. What's better? A simple cognitive screening test. It's inexpensive, non-invasive, takes about 10–15 minutes, and gives a real snapshot of how your brain is functioning. It's the kind of test that helps doctors like Dr. Nana distinguish between normal aging and something that truly needs follow-up without the panic, the stress, or the risk of being sent down a rabbit hole of unnecessary procedures. So, the next time you or someone you love starts worrying about forgetfulness, remember George's story. Sometimes the scariest thing about an MRI isn't what it finds, it's what it makes us believe. And now, brace yourself, because the third test on our list is one that millions of Americans over 60 have likely had maybe even more than once. 3 cardiac stress test. Let's paint a picture. You're in your 70s, and you've noticed you're not quite as energetic as you used to be. Maybe climbing stairs feels a little harder, or you get a bit winded walking up a hill. It's nothing drastic, but it's enough to mention at your next checkup. Your doctor, erring on the side of caution, suggests a cardiac stress test. Just to be safe, they say. And that's where the trouble begins. A cardiac stress test is designed to assess how your heart responds to activity. You either walk on a treadmill or are given medication to simulate exercise while hooked up to monitors that track your heart's rhythms and response. In theory, it sounds helpful. But here's the problem. In people over 70, especially those without clear heart symptoms, stress tests are notoriously unreliable. False positives, or red flags when nothing is truly wrong, happen far too often. And that's when things can snowball. Research shows that in adults over 70, the false positive rate for stress tests can reach up to 40%. That means nearly half of seniors who fail the test may not have any real blockage or danger at all. But once the red flag is raised, doctors feel pressured to investigate further. That usually means a cardiac catheterization, a procedure where a tube is inserted into your artery to look for blockages, and often, the placement of a stent. It's invasive, it's risky, and in many cases, it doesn't improve survival or quality of life. Don't just take our word for it. A large-scale study published in JAMA Cardiology in 2017 reviewed thousands of cardiac procedures. It found that over half of the stents placed after stress test referrals were done in patients who had no significant symptoms and received no measurable benefit. What they did get: higher rates of bleeding, kidney damage from the contrast dye, longer hospital stays, and higher overall costs. Let me tell you about Raymond, a 75-year-old retired postal worker. A lifelong walker, Raymond prided himself on staying active. During a routine checkup, he casually mentioned that he sometimes felt tired walking up steep hills. His doctor suggested a cardiac stress test again, just to be safe. The results? Inconclusive. So, Raymond was sent for a catheterization. The doctors found mild narrowing in one artery, not a full blockage, not life-threatening, but still decided to place a stent. That night, Raymond had a severe reaction to the contrast dye. His kidneys took a hit. He spent 6 days in the hospital, missed weeks of his daily walks, and needed ongoing follow-up care. The irony? His fatigue never had anything to do with his heart. It was a mild electrolyte imbalance and slight anemia, something that could have been managed with dietary changes and hydration. This isn't just about Raymond. It's about the countless seniors who are over-tested, over-treated, and underinformed. The better approach? If you're not showing classic heart disease symptoms like crushing chest pain, shortness of breath at rest, or swelling in the legs, start with simple tests first. An EKG, blood work, and a conversation about lifestyle may be all you need. And if your doctor recommends a stress test, ask questions. Get a second opinion. Understand the why before you agree to the what. Up next, we're diving into test #2- a procedure many seniors are told to get just in case, but it's been quietly linked to a rise in stroke risk and nerve damage. You may have already had it done and never knew the risks hiding behind it. Stay with us. It's one of the most overlooked, yet potentially dangerous tests after 70. In the last section, we uncovered how stress tests can send seniors like Raymond down a dangerous path, from vague fatigue to unnecessary stents, kidney damage, and weeks in the hospital. And the sad truth? His heart wasn't the issue at all. So what's the takeaway? If you're not showing clear cardiac warning signs like chest pain during activity or breathlessness, some tests might do more harm than help. 2. Colonoscopy after 70. Now here's one that might surprise you. Colonoscopy. Yes, the same test that's been hailed as a gold standard in cancer screening. But after 70, and especially after 75, this test becomes a lot more complicated, and in some cases, even dangerous. Let's break it down. A colonoscopy involves inserting a long, flexible camera into the colon to look for polyps or cancer. Sounds reasonable, right? But here's what people often don't realize. The older you are, the higher the risks. First, the preparation is brutal. Strong laxatives that can lead to dehydration, dizziness, and kidney problems. Not exactly ideal for someone in their 70s with more sensitive systems. Then comes the sedation. While necessary to keep the procedure tolerable, it can impact brain function, leading to confusion, delayed recovery, or even longer-term cognitive changes in older adults. And during the procedure, there's a real risk of complications: bleeding, tearing of the intestinal wall, or even irregular heart rhythms during sedation. Still not convinced? A 2019 study published in JAMA Internal Medicine followed over 1.3 million Medicare patients aged 70 and older. The findings were eye-opening. Out of 1,000 colonoscopies performed on patients over 75, only 2 lives were saved, more than 20 patients suffered serious complications. That's a 10-to-1 risk-to-benefit ratio. Even when polyps are found, many are tiny and slow-growing, unlikely to cause harm in someone who's already in their 70s or 80 seconds. Yet removing them can lead to bleeding or infections that require hospitalization. Let me tell you about Dana, a 73-year-old grandmother who ran a cozy bakery with her daughter. She was full of life, had no symptoms, no family history of colon cancer, and had already had 2 clean colonoscopies in her life. But when she saw a new primary care doctor, young and eager to be thorough, she was told it was time for another colonoscopy. Dana trusted the advice and agreed. During the test, a small polyp was removed, and she was sent home. That night, Dana experienced sharp abdominal pain and fainted. At the hospital, they discovered a bowel perforation. She spent 9 days in recovery, lost weight, and hasn't quite felt the same since. When Dr. Nana reviewed her case, it was clear the test wasn't necessary. Her previous screenings were clean, and she had no symptoms. So why was it done? Because once you're in the colonoscopy cycle, it's hard to step back. But the U.S. Preventive Services Task Force now recommends stopping routine colonoscopies at age 75 unless you have specific symptoms or risks. For healthier seniors over 70, there's often a better alternative, a simple at-home stool test like the FIT test. It requires no prep, no sedation, no clinic visit, and still catches most concerning cases. So if you or your loved one is over 70, ask your doctor about alternatives. You deserve to be screened wisely, not aggressively. Because here's the reality. When it comes to aging, less can be more. And now, we've reached the final and most dangerous test on our list. The one that's marketed as life-saving, but may actually be harming seniors across the country. 1 full-body CT scans after 70. Imagine this. You walk into a private clinic or executive wellness center. They offer you a high-tech, full-body CT scan. We'll catch cancer early, they say. Get peace of mind. But behind the sleek machines and smooth marketing lies a deeply concerning truth. These scans expose you to high doses of ionizing radiation, and when done without symptoms, they provide no proven benefit. Let that sink in. There is no scientific evidence that full-body CT scans save lives in asymptomatic people. And yet, they're still offered as part of preventive health packages to aging adults. Worse yet, the fallout from these scans can be severe. A shadow on your liver? A small nodule on your lung? Most of these findings are harmless. But once they're spotted, doctors feel obligated to investigate. That means follow-up scans, more radiation, biopsies painful and risky, or even surgery just to rule something out. All this, without ever having a symptom. The risks for older adults are amplified. Radiation exposure has a cumulative effect, and follow-up procedures in seniors are more likely to cause bleeding, infections, kidney damage, and longer recoveries. It's a slippery slope. What starts as a peace of mind scan can quickly spiral into a months-long medical roller coaster filled with anxiety, bills, and potential harm. Let's be clear. There are CT scans that save lives when done for the right reasons, like chest pain, trauma, or certain cancer diagnoses. But using them broadly as a just-in-case tool in seniors? That's a recipe for overdiagnosis and overtreatment. Dr. Nana always tells her patients, don't chase shadows. Chase your health. Instead of blanket scans, focus on what matters: proven screenings, good nutrition, movement, and mental wellness. Now that we've revealed the 5 most overused and potentially harmful checkups for seniors, here's the big question. What should you do instead? In the next section, we'll show you 5 smart, science-backed ways to monitor your health after 70 without fear, without over-testing, and without putting yourself in unnecessary danger. We've talked about the dangers of unnecessary testing after 70, but few are as misunderstood, overhyped, and potentially harmful as the full-body CT scan. Here's what you may not know. Every time you undergo a full-body scan, you're exposing yourself to 10 to 20 millisieverts of ionizing radiation. That's the equivalent of receiving up to 500 chest X-rays in one sitting. Let that sink in. 500 chest X-rays, all at once. According to a 2023 modeling study published in JAMA Internal Medicine, the increasing use of CT scans in the United States may now account for up to 5% of all cancer diagnoses nationwide. That's right, 1 in every 20 cancers in this country could be traced back to a scan that was supposed to prevent disease in the first place. Not only is that counterproductive, it's downright terrifying. You might think, but what if the scan catches something early? And yes, it can find things. But here's the catch. Most of what it finds doesn't need to be treated. Tiny, harmless nodules, calcium deposits, benign cysts, these are all part of the normal aging process. They don't mean you're sick, but the moment they're spotted, the alarm bells start ringing. Doctors get cautious. Specialists get involved. You're referred for additional imaging, then biopsies, and suddenly, you're stuck in the medical system for something that might have never harmed you to begin with. Let me share a true story. Marcus was 80 years old, fit, vibrant, and still teaching martial arts to younger seniors in his community center. He felt fantastic, no pain, no complaints, just a deep passion for staying active and empowering others. One day, he signed up for a premium senior elite checkup at a private wellness clinic. The package came with a full-body CT scan marketed as a peace of mind service. They found a tiny 3mm nodule on his lung. It was likely benign, but to be sure, they sent him for a PET scan, then a needle biopsy. The result? Benign, completely harmless. But the biopsy caused part of his lung to collapse. Marcus was hospitalized. His breathing weakened. He spent 2 months recovering, missing his classes, his community, and the sense of purpose that kept him young. All of that, for something that could have been left alone. It's a story we hear more and more often. Experts now strongly advise against using full-body CT scans for general screening, especially in adults with no symptoms. The American College of Radiology is clear. There's no proven benefit, and there is significant risk. Here's a simple analogy from Dr. Nana. Doing a full-body scan when you feel fine is like using a landmine detector to search for treasure. You might find something, but the explosion could cause more harm than the treasure is worth. So what's the better alternative? Listen to your body. If you feel healthy, energetic, and aren't experiencing symptoms like unexplained weight loss, coughing up blood, a persistent lump or swelling, then your best move is to stay the course with regular, focused care. That means routine checkups with a trusted primary care physician, blood tests when needed, lifestyle-based prevention, not fear-based screening. Because here's the truth, your time, your energy, and your peace of mind are too valuable to be spent chasing shadows. Let's take a breath and recap what we've uncovered together. These are the 5 most overused and potentially harmful checkups that seniors should think twice about after turning 70. 1. Bone density scans often lead to unnecessary medications with serious side effects. 2. Brain MRIs for memory loss may trigger anxiety, invasive follow-ups, and no clear answers. 3. Cardiac stress tests can lead to risky heart procedures without improving outcomes. 4. Colonoscopy after 75, often more risk than reward, especially with no symptoms. 5. Full-body CT scans, high radiation, low benefit, and a fast track to overtreatment. Modern medicine is remarkable. It's extended lives, cured diseases, and offered hope to millions. But it's not perfect. Sometimes less truly is more, especially as we age. Before you agree to any test, ask these 3 simple questions. What happens if it finds something? What's the worst-case scenario from this test? Do the potential risks outweigh the possible benefits? If the answers are unclear or the outcome could lead to more harm than help, then it may be time to pause and have a deeper conversation with your doctor. And don't forget, real prevention doesn't always come in a test tube or scan room. It starts at home with how you live. Dr. Nana's final prescription for real, lasting health: stay active. Walk, stretch, dance, move your body every day. Eat with purpose. Choose whole foods that fuel your cells, not just your cravings. Sleep deeply. Let your body repair and reset each night. Connect often. Share joy, laugh loud, and spend time with people you love. Choose your checkups wisely. Let science and common sense guide you. Now we want to hear from you. Have you or someone you love ever been through a medical test or treatment that ended up being unnecessary? What happened? How did it affect your health, your mindset, or your finances? Share your story in the comments below. You never know who it might help. And if you found value in this video, if it helped you feel more informed, empowered, or maybe just a little more at peace, please hit that like button and subscribe to Senior Health Boost. We're building a community where seniors take charge of their health, where wisdom replaces fear, and where science is made simple, not scary. Every like, every comment, and every subscription helps us reach more people just like you. Thank you for watching. Stay strong, stay curious, And remember, your best years are still ahead. Subscribe now to Senior Health Boost, and we'll see you in the next video.